Let me begin with a question that may make you uncomfortable, but it's an honest one. When you sit in a doctor's office and explain how you feel, do you ever wonder if you're truly being heard or quietly dismissed? Many seniors sense it, but few talk about it. Today, we're going to talk about it openly because the truth, even when it's ugly, can be empowering. Here are 5 uncomfortable truths about how doctors often view older patients and why knowing them can actually help you live longer and better. Truth number 1. Many doctors unconsciously expect decline. Aging is often seen as a one-way road toward weakness, pain, and dependency. Because of this mindset, real symptoms are sometimes brushed off as just old age. The danger: treatable problems may go untreated simply because of your birth year. Let's talk about one of the most damaging truths seniors face in healthcare today, and it's this: doctors often mistake real health problems for normal aging. This belief doesn't always come from cruelty or bad intentions. It often comes from habit, pressure, and deeply rooted assumptions about what growing older is supposed to look like. But the consequences can be serious and sometimes even life-changing. As people age, they're more likely to hear phrases like, "That's normal at your age," or "What do you expect in your 70s or 80s?" Pain, fatigue, memory issues, dizziness, loss of appetite — these are often waved away as unavoidable signs of getting older. But here's the uncomfortable truth: many of these symptoms are not normal at all. They're signals. Signals that something is wrong, something is changing, and something needs attention. When real medical issues are mislabeled as aging, diagnosis gets delayed. Conditions that could have been treated early, like vitamin deficiencies, thyroid disorders, depression, heart problems, or medication side effects, are allowed to quietly worsen. Seniors may stop complaining, believing suffering is simply the price of living longer. Over time, this creates unnecessary pain, loss of independence, and a decline that might have been prevented. This mindset also affects how seriously seniors are taken. Younger patients reporting the same symptoms are often tested, referred, or closely monitored. Older patients, however, are more likely to be told to rest, slow down, or accept it. That quiet dismissal can make seniors doubt their own bodies, their instincts, and even their worth. But aging is not a disease. Growing older does not mean constant pain, confusion, or weakness should be accepted without question. Yes, bodies change, but many changes can be managed, treated, or reversed when caught in time. The danger lies in silence and assumption. This is why it's critical for seniors to speak up, push back, and ask direct questions. If something feels wrong, it deserves investigation regardless of age. And families must listen too, because advocacy often makes the difference between neglect and proper care. The truth may be uncomfortable, but it's powerful. Many seniors are not just aging. They are being overlooked, and once that truth is recognized, it becomes possible to demand better, live better, and age with dignity instead of resignation. Truth number 2. Older patients are often under-challenged. Doctors may simplify explanations, avoid detailed discussions, or assume seniors won't follow complex treatment plans, but experience brings wisdom, not incompetence. When seniors aren't fully informed, they lose the power to make strong decisions about their own health. Another uncomfortable truth seniors need to hear is this: older patients are underestimated far more than they realize. This underestimation doesn't always show up as open disrespect. Instead, it appears quietly in tone, in shortened explanations, in decisions made for seniors rather than with them, and over time, it can deeply affect both health outcomes and self-worth. Many doctors unconsciously assume that older people won't understand complex medical information. As a result, explanations may be oversimplified, risks and alternatives glossed over, or important details left unsaid. Treatment plans are sometimes chosen based on what the doctor believes an older patient can handle, not on what the patient actually wants or is capable of doing. This robs seniors of one of their most basic rights, informed choice. There's also a damaging assumption that seniors are less motivated, doctors may think. At this age, why push aggressive treatment? Or lifestyle changes won't make much difference now. But this mindset ignores a powerful truth: many older adults are highly disciplined, experienced, and committed when they understand the purpose behind a plan. In fact, seniors often follow medical advice more carefully than younger patients. When they feel respected and included, underestimation can also show up in conversations about quality of life. Doctors may assume seniors are comfortable with limitations, dependency, or discomfort without ever asking. Pain is tolerated instead of treated. Mobility loss is accepted instead of challenged. Mental sharpness is doubted instead of nurtured. Over time, these lowered expectations become self-fulfilling prophecies. What makes this especially dangerous is that many seniors internalize these assumptions. When spoken to like children, people begin to feel smaller. They stop asking questions. They hesitate to challenge decisions. They accept less care than they deserve. Confidence fades not because ability is gone, but because belief is, yet experience, judgment, and resilience often peak later in life. Seniors have navigated decades of challenges, decisions, and responsibilities. That wisdom does not disappear. With age, when doctors take the time to truly listen, to explain fully, and to treat older patients as equal partners, outcomes improve dramatically. The truth is simple but uncomfortable. Underestimation is a silent form of neglect, and the antidote is respect, earned not by youth, but by voice. Seniors who speak up, stay curious, and demand clarity remind the medical world of something vital. Age may change the body, but it does not erase intelligence, dignity, or the right to be taken seriously. Truth number 3, prevention takes a back seat. Many medical professionals focus on managing decline instead of preventing it. Exercise, nutrition, mental sharpness, and lifestyle changes are sometimes discussed less aggressively with older adults, even though these factors can dramatically extend quality of life. Another hard truth every senior must understand is that prevention is often quietly pushed aside after a certain age. Once someone crosses an invisible line, usually in their late 60s or 70s, the medical system often shifts focus from preventing problems to simply managing decline. This shift can be subtle, but its impact is profound. Many doctors begin to think in terms of maintenance rather than improvement. Instead of asking how an older person can become stronger, sharper, or more energetic, the conversation turns to how to slow the inevitable. Preventive strategies like strength training, balance exercises, cognitive stimulation, nutrition optimization, and lifestyle changes are discussed less urgently or not at all. The unspoken assumption is that it's too late for prevention to matter. That assumption is wrong. Research repeatedly shows that prevention works at every age. Muscle can be rebuilt in the 80s. Balance can improve well into the 90s. Memory can be strengthened. Heart health can be protected. Falls can be prevented. Yet many seniors are never told this with conviction. Instead, they are prescribed pills to manage consequences rather than guidance to avoid them. This deprioritization is dangerous because prevention is what preserves independence. When seniors aren't encouraged to stay active, eat well, challenge their minds, and protect their mobility, decline accelerates. Small problems grow into major limitations. A minor balance issue becomes a fall. A bit of weakness becomes dependency. What could have been avoided turns into something permanent. There's also a psychological cost. When prevention is no longer emphasized, seniors may feel their future no longer matters. Motivation fades. Effort feels pointless. Why try to improve if everyone around you expects you to? Worsen. This quiet loss of hope can be just as damaging as physical illness. The truth is, prevention doesn't stop being valuable, it becomes more valuable with age. Every gain matters more. Every avoided setback preserves dignity, freedom, and quality of life. Even modest improvements can mean the difference between living independently and relying on others. Seniors must understand this truth so they can challenge it. Ask about prevention. Ask about exercise, nutrition, sleep, mental health, and full prevention. Ask what can be strengthened, not just what is failing. Bring prevention back into the conversation where it belongs. Aging does not mean giving up on the future, it means protecting it more fiercely than ever. And any system that treats prevention as optional after a certain age is not protecting seniors, it is quietly surrendering on their behalf. Truth number 4. Time is rationed. In a rushed healthcare system, doctors may spend less time with seniors, especially those with multiple conditions. Complex cases take longer, and not every system rewards that time. The result? Seniors must fight harder to be heard. Another uncomfortable reality seniors must face is that they often receive less time and attention in today's rushed medical systems. This isn't always because doctors don't care, it's because modern healthcare is built around speed, efficiency, and numbers. Unfortunately, seniors rarely fit neatly into that system. Older patients usually come with multiple concerns at once. They may take several medications, manage chronic conditions, and experience symptoms that don't have simple explanations. These visits naturally require more conversation, more listening, and more careful thinking. But in many clinics, appointments are scheduled for 10 or 15 minutes, regardless of complexity. When time is short, depth is sacrificed. As a result, seniors are often interrupted, redirected, or gently rushed along. Important details may be missed because there simply isn't enough time to hear the full story. One symptom gets addressed, while another is postponed. Questions go unasked not because they aren't important, but because the clock is ticking. Over time, this can lead to fragmented care, confusion, and growing frustration. There's also an emotional toll. When seniors feel hurried, they may sense they are a burden. They may hesitate to speak up, fearing they're taking too long or being difficult. Some stop mentioning new symptoms altogether, choosing silence over inconvenience. That silence can be dangerous. What goes unsaid often goes untreated. In contrast, younger patients with single, straightforward complaints may receive faster diagnoses and clearer plans simply because their case is the system better. Seniors, whose needs are more layered, are unintentionally penalized for that complexity. The system isn't designed for aging, it's designed for speed. Family members often notice this first. They see their loved ones leave appointments confused, unsure of instructions, or unclear about next steps. They sense something was missed, but don't always know how to fix it. And seniors themselves may assume this rushed experience is normal, that it's just how things are now. But here's the truth seniors must hear. Your health is complex because your life has been long. That complexity deserves time, it deserves patience, and it deserves respect. While the system may not change overnight, awareness changes behavior. Seniors who prepare questions in advance, bring notes, involve advocates, and insist on clarity often receive better care. It's not fair that they must work harder for attention, but it is powerful when they do. Time may be limited, but your life is not small. Being rushed does not mean being unimportant. And seniors must never confuse a busy system with a lack of worth. Truth number 5. Doctors respect seniors who advocate for themselves. This is the most important truth of all. When older patients ask questions, challenge assumptions, stay informed, and stay engaged, doctors respond differently. Respect grows when seniors refuse to disappear quietly. The final truth, perhaps the most important one seniors must hear, is this: self-advocacy changes everything. In a medical system filled with assumptions, time pressure, and quiet bias, the seniors who receive the best care are often not the youngest or the healthiest, but the ones who speak up. Doctors respond differently to engaged patients. When seniors ask clear questions, request explanations, and challenge vague answers, something shifts. The conversation becomes more respectful, the care becomes more thoughtful. Assumptions are replaced with dialogue. Self-advocacy signals that a patient is alert, involved, and unwilling to fade into the background. Many older adults were raised to trust authority without question. They learned not to interrupt, not to argue, and not to appear demanding. But in modern healthcare, silence is often misunderstood as agreement or worse, indifference, when seniors don't speak up. Doctors may assume everything is fine, even when it is in single quotes. Self-advocacy does not mean being rude or confrontational. It means being prepared. It means bringing a list of symptoms, medications, and questions. It means asking, is this really just aging, or should we investigate further? It means requesting alternatives, second opinions, or more time when something doesn't feel right. These small acts can prevent major mistakes. Advocacy also protects dignity. When seniors take an active role in decisions about their bodies and their futures, they reclaim control. They move from passive recipients of care to equal partners in it. That shift alone can improve mental health, confidence, and even physical outcomes. Family members and caregivers play a crucial role here as well. Having someone else listen, take notes, or speak up can make a powerful difference, especially when seniors feel overwhelmed or tired. Advocacy is not a weakness, it is a strategy for survival in a complex system. The hard truth is this: doctors often respect seniors who demand clarity and involvement more than those who quietly accept whatever is given. This shouldn't be necessary, but it is reality. And once seniors understand this, they gain a powerful tool. Aging does not mean surrendering your voice, it means using it wisely. Because in a system that moves fast and assumes decline, the strongest protection a senior has is the courage to speak and the refusal to disappear quietly.